Feel the cold of the marble against your back. The wet, pulsing weight on your chest is not a nightmare. It is your doctor's finest treatment. Dozens of leeches are draining you dry, and every open wound on your skin is an open door. For whatever killed the last patient on this table, this is Tudor medicine. You are not being tortured. You are being treated by one of the most respected physicians in England. The ward around you smells of damp stone and something metallic. Blood, mostly yours. You have been here for 2 hours, and the leeches placed across your chest and abdomen have not stopped feeding since the moment they touched your skin. Your doctor watches from across the room, satisfied. Your color is fading, and to him that means it is working. This is not barbarism. This is the cutting edge of Tudor medicine, and the man overseeing your slow draining holds a legitimate license to practice. Here's what your doctor genuinely believes. Your body runs on 4 fluids: blood, phlegm, yellow bile, and black bile. Every disease, every fever, every infection is simply one of those fluids falling out of balance. You arrived with a fever, which means, in his framework, that you have too much blood. The solution is elegantly simple. Remove the excess. Restore the balance. Collect the fee. What he cannot see, what no one in 1550 has any framework to even suspect, is that your fever is caused by a bacterial infection already spreading through your bloodstream. Your immune system is fighting it. Your white blood cells are mobilizing. Your body is running a biological defense operation at the cellular level, and your doctor is systematically dismantling it. Each leech removes between 5 and 15 milliliters of blood per feeding session. You have 23 leeches on your body right now. Do the math. Within the hour, your blood pressure will begin to drop. Your immune response, which requires enormous metabolic energy and a stable circulatory system to function, will start to collapse. The infection your body was actively fighting now has open terrain. But there is a second layer to this that your doctor has not considered, because contamination as a concept does not exist in his world yet. Leeches bite, feed, and regurgitate. It is part of their digestive process, which means that whatever was living in the bloodstream of the patient treated on this table before you is now entering your open wounds. Syphilis, tuberculosis, skin infections teeming with bacteria your immune system has never encountered. The leech is not just removing your blood. It is functioning as a biological bridge between every patient in this ward and your circulatory system simultaneously. Your doctor refills his notes and nods approvingly. The treatment is proceeding exactly as planned. And you, lying cold and increasingly pale on that marble table, are about to meet the man responsible for the next phase of your care. The individual who will decide whether you need something far more invasive than leeches. The barber is sharpening something in the corner, and it is not scissors. It is a saw. An iron saw with a blade darkened by rust and dried material that you choose not to identify too closely. He wipes it with a cloth that has clearly been used on several patients before you. He does not rinse it. He does not heat it. He folds the cloth, sets it aside, and walks toward you. This man cuts hair in the morning and removes limbs in the afternoon. That is not an exaggeration. That is his job title. The barber surgeon is the most hands-on medical professional you will encounter in Tudor England, and the red and white striped pole outside his shop represents exactly that dual function. White for bandages, red for blood. You have seen that pole your entire life in the modern world and never once considered what it was advertising. He is not incompetent by the standards of his time. He has apprenticed for years. He has watched amputations, assisted in extractions, and developed a genuinely skilled hand with a blade. The problem is not his training. The problem is everything he does not know and has no way of knowing. Sterilization does not exist as a concept. Germ theory will not arrive for another 300 years. To him, a clean tool is a tool with no visible debris on it. The cloth he just used to wipe that saw is doing nothing except moving contamination from one surface to another. The bacteria coating that blade right now are invisible, odorless, and utterly lethal, and neither he nor anyone else in this building has even a partial framework to suspect they exist. The leather straps come next. They bind your wrists and ankles to the table, not out of cruelty, but out of experience. He has done this enough times to know what happens when the pain hits, and the patient's body tries to make decisions on its own. There is no anesthesia. There is no sedative beyond a strong drink, which you may or may not have been offered depending on how much your family paid. What there is speed. The best barber surgeons in Tudor England were valued almost entirely on how fast they could complete a procedure because every additional second under the blade was another second of unmanaged shock, destroying the patient's system. Some surgeons trained to amputate a leg in under 90 seconds. That sounds impressive until you are the one strapped to the table feeling every single one of those 90 seconds with absolute clarity. The smell in this room is its own kind of violence. Sweat, old blood, and beneath it something sweet and wrong that you will later recognize as the early signature of infection and wounds that were never properly closed. The walls have absorbed years of it. There is no ventilation designed into this space. You breathe it with every shallow breath your body manages between waves of pain. Your doctor ordered this procedure because the humoral theory demanded it. The leeches did not balance your fluids sufficiently, so the next intervention is more direct, more structural. The barber surgeon does not question the order. That is not his role. His role is execution. And somewhere beneath the fear and the cold and the leather cutting into your wrists, a part of you registers the most terrifying detail of this entire situation. This man is genuinely trying to help you. He believes in what he is doing. Everyone in this room believes in what they are doing. That is the part that should frighten you most. Because blind confidence and a rusty saw in the hands of a man who has never heard the word bacteria is not medicine. It is something else entirely. And the ingredients he is about to use to dress your wound are going to make absolutely certain that what comes next is worse than the cut itself. The physician reaches for the shelf with the confidence of a man who knows exactly what he is doing. What he places on the table beside you represents the most advanced pharmacological arsenal Tudor medicine has to offer, and it will finish what the leeches and the blade started. Mercury is first. For syphilis, skin conditions, and a broad category of infections that Tudor medicine groups loosely under corrupted blood, mercury is the treatment of choice across every level of society. Your physician rubs a mercury-based paste directly into your skin and instructs you to sleep beneath heavy blankets to sweat the poison through your pores. What is actually happening is that the toxic metallic compound is absorbing through your skin and accumulating in your nervous system, your kidneys, and your brain tissue. The sweating is not purging the disease. It is your body in the early stages of heavy metal poisoning, desperately trying to expel something it has no mechanism to fully remove. The king's physician uses mercury. The village healer uses mercury. The barber surgeon stalks it alongside his blades. Social class offers you no protection here because the poison is distributed equally across the entire medical system. Arsenic follows a similar logic. Applied as a corrosive metallic paste to skin lesions and open wounds, it does produce a visible result. The infected tissue dies and peels away. To a physician working without any understanding of cellular biology, this looks like progress. The wound is changing. The corruption is being burned out. What he cannot see is that the toxic mineral compound is also destroying the healthy tissue surrounding the wound, compromising the surrounding cellular structure, and introducing a systemic poisoning load that your already weakened kidneys are now being asked to filter on top of everything else they are managing. There are also the oral preparations. Syrups and tinctures containing heavy metal agents were prescribed for internal infections, fevers that would not break, and conditions that today would be resolved with a single course of antibiotics. You drink them because your physician instructs you to, and because the burning sensation in your stomach feels like it must be doing something. It is. It is eroding your gastric lining and beginning a slow destruction of your renal function that, combined with everything else currently happening in your body, is accelerating a timeline you cannot afford to accelerate. The cruelest detail in all of this is that some of these treatments produced short-term results convincing enough to validate the entire approach. Mercury does suppress certain bacterial activity on the skin's surface. Arsenic does destroy infected tissue. In a world without control groups, without longitudinal studies, without any framework for distinguishing correlation from causation, a patient who survived despite these treatments became evidence that the treatments worked. The ones who died were simply too far gone to save. You are running out of time, and the room around you is beginning to smell like something your physician already recognizes and has already quietly stopped treating with urgency. The smell means the conversation has shifted from medicine to prayer, and you are about to understand exactly what that means. You smell it before you feel it. Something sweet and deep and wrong, coming from beneath the bandages on your surgical wound. Your physician walks in, lifts the dressing, and his expression does not change. But he replaces the bandage faster than he removed it and does not meet your eyes when he speaks. That smell is necrosis. Your tissue is dying from the inside out. What is happening beneath that bandage is a process called septicemia, a systemic bacterial invasion of your bloodstream originating from the surgical wound that was closed with unsterilized tools in a room saturated with pathogen loading from every patient treated there before you. The bacteria are no longer localized. They are in your blood, your organs, and spreading with every heartbeat your weakened circulatory system still manages to produce. The gangrene that follows necrosis in a Tudor hospital is not a complication. It is the default outcome for a significant percentage of surgical patients, so common that physicians of the era developed an almost clinical detachment toward it. There is nothing in their toolkit to stop it. No antibiotics, no surgical debridement under sterile conditions, no intravenous intervention of any kind. The toxic mineral compounds on your shelf cannot reach what is already systemic. The humoral interventions have nothing left to drain. Your physician has not abandoned you out of cruelty. He has simply reached the end of what his entire civilization knows how to do. He writes his notes, adjusts your blanket, and on his way out speaks briefly to the priest waiting in the corridor. The priest enters, sits beside you, and begins to pray. In Tudor England, this transition, from physician to priest, was not a failure of the system. It was the system working exactly as designed, handing you from the science of the living to the comfort of the dying in a single quiet hallway exchange. You did not lose because your doctor was careless. You lost because the entire biological framework of your era had no accurate map of the enemy killing you. And without that map, every treatment, every remedy, every confident intervention was just another door opened for the infection to walk through. The sun is going down. Your temperature is climbing. And the silence in this room is no longer the silence of a ward at rest. If this made you genuinely uncomfortable, that means it worked. Because the history of medicine is not a story of steady progress. It is a story of confident people doing catastrophically wrong things for a very long time, and a handful of others slowly proving them wrong at great personal cost. There is an entire archive of those stories on this channel, and every single one of them will change the way you look at the world you live in today. Subscribe so you do not miss the next one. Leave a comment telling us which Tudor treatment disturbed you most. And if you found this valuable, hit the like button, because that is the single most effective way to make sure this kind of content keeps getting made.